Step 28, trigger injection. I will explain you the role, type, dose, and interval of the trigger injections. Natural menstrual cycle, when you're developing large follicle, you produce a lot of estradiol hormone, and your pituitary senses that and produces LH hormone for maturation of the eggs and ovulation. Before your eggs ovulate, they have to go through the maturation. So before LH surge, all your eggs have 46 chromosomes. So after the LH surge, they need to throw away 23 chromosomes and keep only 23 X chromosomes. If this happened, if they gone through this process, that means these eggs are mature, or also called M2 eggs. And then after that, eggs ovulate, then fertilize with a sperm which has got 23 chromosomes, and then together embryo has 46 XX or XY chromosome, which is normal for the baby. We need to replicate this in IVF treatment cycle because we blocked your pituitary. Now we need to give a trigger injection. We use HCG injections for the trigger because HCG is very similar to your LH. So we use HCG as substitute to your LH hormone. There are three different types of triggers: artificial HCG, biological HCG, and agonist triggers. In terms of artificial HCG, Ovidrel is artificial HCG. Pregnal, Brivactid, Choriamon, and Nuvarel are biological HCGs. Decapeptyl and Lupron are agonist drugs. And also we can use a mixed trigger, which means we can combine agonist drug with artificial or biological trigger. Importantly, so you can use biological or artificial HCG in your agonist cycle as well as in antagonist cycle. But agonist trigger, the decapeptyl or Lupron, you can only use in antagonist cycle because you already blocked your pituitary using same drugs. You cannot use the same drug for the trigger. And very importantly also you need to remember is if you had only agonist trigger, decapeptyl, Lupron or Cinarel trigger, you cannot have a fresh embryo transfer. If you had an artificial trigger mixed or artificial trigger only or biological trigger only or biological trigger mixed with agonist trigger, you can do fresh embryo transfer. So in terms of trigger dose, you have three different doses: low, average, and high dose. You give a low dose trigger in patients with lots of follicles. If they have risk of OHSS, you give a little bit lower trigger. So you give a high dose trigger in patients with a low ovarian response, if they have a very low number of follicles, and if they had a problem with the late maturation of the follicles or eggs. And the average trigger is just standard for everybody when they're starting their first IVF treatment cycle. In terms of dose, if you give HCG 2,500, that's low dose, 5,000 to 7,500, that's average dose, then anything more than 10,000 is high dose. That you can those units you can use for pregnal, Choriamon, all these biological triggers. In terms of Ovidrel, 250 microgram or 1 ampule of Ovidrel is equal to 7,500 units of HCG. If you had a double dose Ovidrel, then that means that you had the high dose trigger. If you had a half dose of Ovidrel, that means you had a low dose trigger. If you had just simple one ampule 250 micrograms Ovidrel, then that means you had average dose trigger. Trigger interval, which means from the time you trigger to the egg collection, has to be very precise, because if you do a little bit earlier, you get immature eggs. If you do a little bit later, you may already have ovulation. Average duration is approximately 36 hours from the trigger to egg collection. And in some patients you may need to give a shorter period of time, maybe 35 hours, and some patients you may need to give a longer time. For example, if you had an average dose trigger in the first IVF cycle and you already ovulated by the time you had egg collection, then next time you need a shorter time for the trigger. So let us say 35 hours, even maybe 34 hours. If you had a lot of immature eggs, then you may need to have a longer time for the trigger, because there's individual differences in terms of how you respond, how quickly your eggs go through the maturation. Average time is 36 hours, but in some patients they need longer, or some patients need lesser time for the trigger. But for you, it's very important to get the time of the trigger right according to the instruction. If you miss the trigger, if you had any problem with the timing of the trigger, if you did too early, too late, If you spill the trigger, you should immediately inform the clinic, because they really need to know. They may need to be able to adjust the timing a little bit if there wasn't huge difference between instructed time and actual time you gave, but you certainly need to discuss with the clinic. In order to do that, you need to set your alarm on for the trigger time. Sometimes you may need to trigger in the middle of night, so you need to have your alarm on. That's very critical. Other drugs, you can have a difference in half an hour here and there, but for trigger you need to give a precise time and precise drug and precise dose. For that, you need to open your instruction and read actual name of the trigger, dose and time. You need to read 2-3 times to get it right, and then dial the trigger and then give under the skin around the belly button, and discard the syringe in a safe container. You can see that understanding the role of the trigger, understanding the difference between drug types and dose and interval between trigger to egg collection is very critical to get good amount and good quality of eggs. That's very critical or crucial in terms of determining your success in IVF.